Okay, thanks very much. Genevieve and Javina have just asked me to talk to you a little bit about the way that the Hot Hub is going in Harrow. So we've seen about 100 patients so far. We usually admit about 6 or 8 patients every day. That means we've seen patients that, in general, are very low in oxygen. And I think that's the message we'd like to try and get over to you, is that there seem to be 2 groups that do end up in hospital. Ones are the ones who really do look ill and will struggle in here and struggle into the lift and have very low oxygen saturations. And I don't think many of us would not admit that group of patients. But the second group are more interesting, and they actually are breathing very normally when you see them. They've got very little change in their daily living, and they've just had the illness for a very long time. And when you put a SATS probe on their finger, they're registering 80% or 85%. And so that group are the other ones that we're sending in as well. So I think that those are the messages that we're getting over here. We're seeing, if you like, 4 main groups. We're seeing the worried well, which are the people that are really worried about getting COVID and come in hyperventilating, and their saturations are 100%, and their Roth scores are absolutely perfect, even in Romanian. That group are the group that, it would be nice if we could get them out by telephone only. And I think that's the other message, is that all the clinicians that are working here are now gaining experience of COVID. We are turning around maybe 20 or 30% of patients who've been sent into the hub by giving them telephone advice. We'll even talk to them while they're waiting in the car park to come in, and they'll turn around and drive out, and they're very satisfied with that. So don't worry about the second triage, but do think that there are ways that you can assess these people on the telephone. And if I could draw your attention to the very good infographic produced by the BMJ by Trish Greenhow. So that goes through it in a very simple way about the things that you can do both on the telephone and by video to assess your patients with COVID, to see whether they need a face-to-face consultation, because a face-to-face is very much the last resort. We're putting ourselves at risk to in a very small way when we see patients face-to-face, and so we really do need to have patients that do need to be seen. And as I say, that group of who might have very low oxygen levels are the ones that are probably the most seen. The second group we see are people who are obviously COVID and are well and are maintaining their oxygen levels, and we send them home with advice. But it is picking up that third group that I think is probably our chief point. The very, very ill ones are usually very resistant to going into hospital, and have so come along to us as a way of sort of trying to avoid going into hospital. But when we explain to them that really that is the only option, then they're usually very willing to go. I think the lessons we've learnt is that COVID is a very stereotypical illness, so the illness lasts the same amount of time in all patients, that the symptoms and signs occur at the same time in most patients. And really we're talking about the patients that we need to see, who are the ones that are going into the second and third weeks of their illness and becoming increasingly short of breath. The first week is usually no problem for anybody. So if you've got people in their first week, you can usually relax and give them advice. But coming into the second week, if they're getting short of breath, if they can't do the things that they do around the house, if they're really struggling to get out of bed and go into the bathroom, those are the sorts of ones that we like to see. A lot of debate about the Roth score. I'm sure we're all trying it. We're all getting better at it. I can't say that it's terribly helpful, but no doubt I'm just not very good at it. But keep on using it. And it's nice to see that you are trying to do something in general practice to see how breathless people are. But I think the thing that we find most useful is really talking about daily living and the things that they do, and trying to get an idea about just how short of breath they are in doing the things that they normally do. Another very important point that I think I ought to mention is that you can also stratify people according to previous illnesses too. So we do know that comorbids are very important. So if we know about the comorbids before we see them, and we'll always ask about them, but when you are talking to people on the telephone, be very aware that the obese, the diabetics, the people with heart disease, the people with previous lung disease, they are especially at risk. And they're the ones that you should also think about getting seen here at the hub. And then finally, some sort of practical stuff. The way we work involves patients coming here by car, because sitting around waiting in the car while the rooms are cleaned, getting re-triaged, waiting for ambulances to clear rooms, things like that, mean that sometimes you have to hang around a bit. And so sitting around in your own car is a vital part of the whole pathway. So we really can't see patients that tip up here by cab or tip up here on foot. And unfortunately, over the last few days, that's happened on a couple of occasions. And it makes it actually quite a difficult thing to run this clinic. So that's the other message. You want to tell them all that they're going by car. They may have to wait around in the car. They will get rung by a doctor or a clinician while they're in the car. And tell them to go to the loo first as well, because we don't want them to go to the loo here. As I said in my last video, we've got a fantastic group of young doctors, and we really would urge everybody to come and have a go at the hub. You're never on your own. There's usually me supervising in the background, and there are 2 doctors working on the shift along with our infection control nurses and our escorts and our receptionists. We've got the system pretty well organised now, and we've got lots of PPE, so we think we're very safe, and keeping the place absolutely spotless after every consult is really stamping down on the virus to give it a go. And I think it would be great if every practice in Harrow was to provide one GP to come and do a session here, so you could get an idea about what's going on and feed that back to your telephone partners, your partners who are in isolation at home doing telephone consultations, so that you've got a real feeling about the way that this hub works and what we're doing to try and keep Northwick Park afloat and keep our patients healthy in the community. So just to say that that these are new skills. We're learning them all as we all go along. We're all getting used now here in the hub to see COVID patients, and we get a feeling for the ones that are sick and the ones that aren't. So it's worth coming along just to learn those new skills. And it's also about making difficult decisions as well. The very sad parts that I'm sure you've all been aware of is that when patients arrive at Northwick Park, their relatives aren't allowed to go in with them. And so if you see someone who is really very sick and you know that is unlikely to survive, one of the difficult conversations we have to have here is about saying to wives and children that perhaps they may have to say their goodbyes before they get in the hospital. And so that's something that I've never done in my clinical career before, and we're all getting good at sort of doing that, although it is a very difficult one. So we think we're doing a good job. We think we're doing a valuable job for Harrow. We're here for a while longer, so please, all of you, think about coming to work. And if there's any queries that you have about the way that we run things here in the Hot Hub, do feel free to email me or ring me. And obviously there will be questions in this webinar today. Thanks for watching.